Hello there. Going to live to share with you a little bit about a poster that we got accepted in the Functional Neurologic Disorder Society conference that's coming up this month here in June. So I wanted to get on here to share about this particular poster that we submitted, the outcome that we had. This is for a person who had a functional neurologic disorder with post-concussion. So actually somebody already posted a question. How much does your FND treatment cost? Great question. So I'll answer that since you already asked it. So we have different ranges for our programs. So we do intensive programs everywhere from 1 week to 10 weeks. Actually, maybe the shortest is about 2 weeks. And I'm going to actually share with you this poster of a case that was a 2-week program. And the cost per week actually depends on how much a person needs. So how many visits they need per week between PT, OT, psychology, and yoga therapy. And that really depends on the person's symptoms and where they are functionally. So what we do for people is actually set up a free consult. They apply to our program online. You can find it at reactivept.com, integrated programs. Apply online. We do a free consult. We do it over Zoom if somebody lives far away. And that way we can make a recommendation that's particular for that person and give you a good idea of what it would actually cost. We have 3 different tracks based on how many visits the person needs. And our therapy visits are reimbursable by insurance too. So we actually check that ahead of time so that you know. So that was a little bit of a long answer because it's not a cookie cutter program where it's like one size fits all. It's individualized. So thanks for asking the question. And apply online. Let's do a free consult. Let's figure out if this is the program for you or if we recommend somewhere else too. We're not afraid to recommend other places. We're not the right fit for everybody. Now I want to chat with you about this poster. So I'm really excited about this. So I'm going to share the poster itself, or at least a piece of it, and then I'm going to share each of the pieces. So the Functional Neurologic Disorders Society is hosting a biannual, they do this every 2 years, conference. It's in Boston this year. And myself and our Movement Disorders Fellow, we both submitted a poster that really represents our whole teams. This one particularly, I'm going to read you the full name. It's called Integrated Care Management Across State Lines for Persistent Post-Concussion Symptoms and Functional Neurologic Disorders, a Case Report. And I put this together myself, Alan Wu, who is a movement disorder specialist at Northwestern, Maddie Roche, who's one of our PTs in West LA, Natalie Thomas, who's one of our PTs, and Naoya Okura, who is our OT that worked on this case as well. So we just got news that it was accepted, so we're really excited to share this with the world. I'm not going to walk through the entire poster, but I want to hit on a couple of highlights here so you could just see what is really possible for a person post-concussion. So gosh, these look a little funny on here. Let me see if I can share them. So when we put together a poster, we typically start with a case description, and particularly we put together this poster for a very specific reason. One is to highlight that you could have a functional neurologic disorder after a concussion. We have seen this many times, and it's very treatable too. Another big point about this is that we coordinated care across multiple state lines for someone. So a neurologist in Chicago, we were doing a program in California. There was another endocrinologist in another state and another neurologist in Texas. So it was many different folks across state lines, and this was very unique and important when you have hormonal issues that might be feeding into symptoms. Is coordinating care with that endocrinologist, right? So what we do and what you can see here is we use our pie chart. We started here by describing that person's subjective report of symptoms that they experienced after their concussion. So post-concussion symptoms and symptoms related to a functional neurologic disorder. So we describe her case here and what she described as primary symptoms. And then in the poster, so let me show you another little piece here. Yes, Bella, the pie chart. I love the pie chart too. And Bella, as you know, this really helps us make sense of what's happening and simplify it and kind of put it into pieces, right? The autonomic piece, the sensory piece, the motor control piece. So this is all part of our initial examination for people. And a really big part of a whole person approach to a program is assessing this at multiple levels: PT, OT, yoga, psychology, all really helping understand that person holistically and really honing in, as Bella says, yes, on what is that biggest piece of the pie, right? And so what we found here in this particular case, there were sensory pieces, there were motor control pieces, cognitive, lifestyle pieces, huge autonomic pieces as well as cervical and other physical impairments that needed to be addressed. There's a great little picture here, the last day of a two-week program, and then we included this little great diagram that I love that she put together 4 months at the follow-up, a kind of a day in the life. What does that look like? How is she managing symptoms 4 months later and getting through PT school, which is phenomenal. So I want to show you just another little part here. This shows you the map of where we were coordinating all of our sessions or discussions with other providers across the country. And I think one of the biggest things was we had a session with PT and had the movement disorder neurologist join us online. He had only met this person via telehealth and hadn't really had the hands and the in-person time to actually assess things. And this was so helpful. And you can read this quote here. I'll read it to you. It says, "Re+active was willing to listen and hear me out on my every concern and question I had and get to the bottom of my symptoms." That's where the pie chart comes in handy. I feel confident leaving with answers, which is the first thing I wanted. So this was a short intensive, only 2 weeks. It's not that we were going to make huge changes to every part of the nervous system at the time, but we could get to the bottom of things and get some answers and start on that pathway of understanding and implementation. And that's exactly what we did. So I want to show you lastly here, some of the results. This table is super tiny. I'm not even sure I can totally read it there. But you can see some of the measures that we use. We really love the patient-specific functional scale. We look at underlying anxiety, depression, look at the concussion clinical profile, of course, in somebody post-concussion. And you can see pre and post. So this is just 2 weeks of PT, OT, neuropsychology, and then a 4-month a 4-month follow-up. What was most noticeable to me here was one, that the specific function changed, and notably that there was less avoidance, that a lot of the generalized worry about symptoms and anxiety improved. And this is what happens when you get answers. It makes sense to you, and there's less of that concern and worry about things. And then most importantly, also we can see that the concussion clinical profile changed, and that we use the PGIC, Patient Global Impression of Change, and we can see that this person rated it moderately better, a slight and noticeable change. So again, this is an outcome in a 2-week intensive program. So here, I'll stop sharing this. For somebody who was post-concussion and developed functional neurologic symptoms post-concussion. So you can see, are they done with recovery? No, there's so much more to happen after only two weeks. 2 weeks really helps you discover, get answers, and start to make some shifts in the autonomic nervous system, vestibular, visual, sensory, and start to build really a toolbox. Build your tools, have the knowledge so you can take it and run, right? And really make changes on your own. And we find that a lot, is that people continue to make those changes. So this was pretty exciting. We're really excited to share this poster in full at the conference coming up in July. So be sure to, in June, the end of this month, be sure to stay tuned. We have another poster. Actually, this is Bella's case that Lincoln and her team put together as well. We're really excited to share that one with the world. That was a much longer intensive with enormous functional improvements. So stay tuned. We're going to share a little bit of that poster as well. And I just want to thank you for joining me every week. We're learning so much all of the time. And I love just getting out here and sharing it with you, what we're learning and doing. So thanks so much for being here and being a part of this community. And if you're on your on our newsletter, reactiveeducation.com or reactivept.com, we'll send out our videos and resources every week. And I'll see you there. Have a great evening. Thanks so much.